Hi, I'm Craig Phillips, physiotherapist and director of DMA Clinical Pilates. There's a lot of Pilates around recently, but in the last 35 years since we introduced Pilates to physiotherapists, we've been involved in a lot of research with a lot of organisations. The most exciting announcement is a recent PhD paper from Nanyang Tech in Singapore, looking at DMA Clinical Pilates versus generic exercise and generic Pilates. The findings from this have been looking at the individualization process, and that is we know every patient is different. Question is why and how. We can't use one size fits all. What we've been looking at is function. Pain and function go hand in hand, and simple tests can give us a lot of information. In this case, we're looking at a patient with a right side low back pain, SIJ pain, and radiculopathy. And by subgrouping that patient, that is, giving them exercises only on one side and in one direction, we're able to record a significant change. The big step forward here is the fact we're doing one-sided and one-direction type approaches, unilateral, unidirectional. Standard exercises is multidirectional and bilateral, and therein lies the problem. So this unilateral approach has been tested for inter-rater reliability. Tokyo University has done a number of papers showing that it's got a 0.87 kappa, so it's not guesswork. It is highly reliable. So the study is looking at this directional model versus non-directional general Pilates and non-directional general exercises. A double-blinded randomized controlled trial, 2-arm, is the gold standard. This is a 3-arm, more complicated, but giving good results. And here we're looking at pain, function, and disability, looking at baseline matching of the three groups. The intervention of general exercise got some improvement, but the clinical Pilates was significantly better at the P001 level, and that was maintained over the next 6 weeks after a 6-week intervention. Same with function, baseline matching, significant improvement with smaller variation. There's a large variation here, which continued to improve, and also with disability. So the take-home message here is that every patient is different, and we know that difference is their response to directional load. So join us at Clinical Pilates, see what the future's got for chronic pain management and where the research is going to take us.